and on each side there will be the temporal bone. This is called the temporal bone. And of course, this is the eyeball, and this is the nasal side of the eyeball, and this is the temporal side of the eyeball. However, it's quite important to see that the nasal side of the eyeball is able to visualize the temporal side of the space, right? Or what you can see in front of you. And the temporal side of the eyeball, which is this one, is able to visualize the nasal side of the space in front of you. So it's, again, the vision is crossed, and it's particularly important. I'm going to explain later on why this is important. So it's very important to specify which part you're talking about. Is it the temporal side of the eyeball or the temporal side of the visual field, or the field of the vision? So let's start by talking about the optic nerve. The optic nerve, it originates from the retina. It's called the ganglionic layer of the retina. And the fibers will converge or come together to form the optic nerve. And then they will leave the eyeball through a canal called the optic canal, which we explained previously in the skull bones. So it will leave the eyeball through the optic canal around 3 to 4 millimeters towards the nasal side, because this is the nose. And then they will continue all the way down until they form the optic chiasm. So both optic nerve will unite together to form the optic chiasm.